if we want to solve these kind of interesting and huge problems, we're going to have to think of creative ways to kind of get around that.
There are a lot of creative ideas out there for alternatives to the patent system, or supplements to the patent system, that could solve some of the issues that we have currently.
It is much easier and in any case much more realistic to think about what we can do within the framework of the TRIPS agreement. So one very important option that I'm developing with an international team of people from various different disciplines is the option of the Health Impact Fund. The Health Impact Fund rewards pharmaceutical companies for reaching poor people even in remote areas. Any human being counts for one, so if you improve the health of a rich person in a rich country, you get no more and no less of a reward than if you improve the health by an equal increment of a poor person in a poor country.
A number of different prize systems where companies would be able to, in return for inventing an important health technology that had a huge health impact, they would be able to get prize money that was proportionate to that impact.
The idea of an advanced market commitment, which was worked out by Michael Kremer at Harvard with various collaborators and economists at Harvard. The advanced market commitment, basically the government says to pharmaceutical companies, if you can develop a drug of such and such a sort that meets these requirements, then we guarantee that we will buy or subsidize a certain number of copies of that drug in such a way that you have a guaranteed market. So if you find then buyers who are willing to pay $1 for a pack of medicines, we'll give you $14 to make it up to $15. So you're treated almost as if you had a patent, you had a markup and so on. There are alternatives in the field. Jamie Love has an alternative to basically have a system where all patents would be abolished for pharmaceuticals, and you would have a mandatory system where everybody would be registered, would be getting a reward on the basis of health impact, on some sort of basis in terms of usefulness and so on.
The trade agreements that the United States negotiates with other countries is something that we do from a public perspective that no foundation or private party is going to have much of an impact on, and fixing that problem would go a long way. Now, we've started to see some interesting progress in countries like Bangladesh, where Grameen Bank partnered to create, to get cell phones into a lot of the villages using microloans, which helps from an economic development perspective. It means that the women who have the cell phones can rent out time to the other villagers. It means that if you need to call a doctor, you can. But that economic development then also allows for improved health care. So if somebody needs medication to treat their child for some disease, they can call a doctor and make arrangements to get the medication. The things are related. So the kinds of activities that the Grameen Bank has engaged in terms of economic development, combined with the kinds of activities that organizations like the Bill and Melinda Gates Foundation have engaged in to develop new drugs, get them distributed, and measure the effectiveness of those programs in the developing world, are steps in the right direction.